In comparison, what would an ECG showing irregularly irregular waves look like? If you see this ECG strip, you will notice that not only are the number of squares changing, but there is no pattern to follow. Sometimes the number of squares is about 4, sometimes 3, sometimes 4 again, but there's no pattern to follow. This ventricular response is called irregularly irregular, and it is seen in atrial fibrillation. In the same slide of atrial fibrillation, you can also see other things. For example, there is no P wave. P wave is consistently absent throughout the whole ECG. Moreover, you may notice fibrillary waves, these small jagged lines. These are different from the skeletal muscle contractions we discussed earlier, as fibrillary lines are present throughout the ECG in atrial fibrillation. Moreover, sometimes you may see notching. The notching is seen in the QRS complex, and it shows interventricular delay, which happens in atrial fibrillation. Lastly, sometimes you might see a slope of the S wave. The slope represents a digoxin effect in certain patients who are taking digoxin while having atrial fibrillation. The causes of atrial fibrillation are numerous. It includes hypertension, hypothyroidism, alcohol intake, sick sinus syndromes. There are too many to count.